When can you have sexual intercourse after plastic surgery? It's a question everybody wants to ask, but few people do. So let me help make some sense of that question right now. So a few things happen when you have sex. Your blood pressure increases and your heart rate increases, and that can increase the risk of bleeding if you are close to surgery. So that's point number one. So if I said you can exercise, that means you can probably have sex unless you had a procedure performed that would be stressed or affected with sex. For example, if you had a labiaplasty performed, or surgical vaginal tightening, or a medial thigh lift, or something that involves your genitalia and your medial thighs and your groin, you probably need to wait 8 weeks to have sex. And I mention it in the different recovery videos for those procedures. And if I didn't mention it, by all means, shoot me an email, call us, ask us when it's appropriate to have sex again. If the procedures you had performed did not involve your genitalia or your thighs whatsoever, then as soon as you can do exercises or cardio exercises, which is usually 1 week after any drains are removed or 1 week after surgery, then you can have sex. So if I said it's okay to exercise and do cardio, like I said, it's usually 1 week after the last drain comes out or 1 week after surgery. That means you can have sex at that time as well, as long as the procedure and the healing don't involve any of your genitalia or your medial thighs or anything like that. Now, if you had a tummy tuck, there is a healing incision not too far from your genitalia. So I would encourage you to wait until that incision is mostly healed before you have sexual intercourse. If you had some procedure performed on your breasts or your chest, I would again encourage you to wait a little while before you have sexual intercourse. Even if I said you can exercise, you might want to wait a little bit longer. For example, say you had a breast augmentation and nothing else done. If all you had was a straightforward breast augmentation, I will tell you you can exercise in a bra 1 week after the surgery as long as you're not bouncing during your exercises. That means you could also have sex 1 week after surgery, but your partner has to resist touching your breasts. So that's an important point to make. So in general, if I said you can do cardio, you can also have sex as long as sex does not put stress on or involve any of the healing parts of your plastic surgery procedure. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.